Hi, I'm Hillary Talbot, acupuncture physician and clinical herbalist, coming to you today from St. Petersburg, Florida. Today we will be discussing acupressure points for headache. Now there are several points that you can use, and most of you know the command point on the hand for the head, LI4, located between the first and second metacarpal at the high point of the muscle. Now if you press with moderate pressure with the finger and the thumb on the other side, you can usually elicit a kind of a deep ache. And if you clue into your head, notice if this starts to make the headache lessen. Now there are several different reasons why you could be having headaches. Oftentimes, if you visit your local acupuncturist, we'll ask you, where does the headache occur, in order to better understand which points will be more effective for the headache. Is it in the front and in the forehead? Is it located on the temples, at the top or vertex of the head, or at the base of the skull and the occiput, which we call tension headaches? This will better allow us to pick different points in particular for your specific headache. 2 points that are pretty widely used are stomach 8. Stomach 8 is found, they're bilateral, of course, just on this side of the hairline, right where it creases from across and down. And if you kind of search around with your finger, you'll often find a little divot letting you know that you're in the right place. And gently massaging these with a circular motion with the pad of your finger is often effective enough. And these are great for frontal headaches that come across the forehead, as well as those that affect the temple. You know, a lot of us intuitively will actually rub our temples when we have a headache, if that's where it's located. And occasionally, if it's really throbbing or bursting, even that light pressure can be too much. So this can be a slightly distal point that would help relieve those types of temple headaches. And you just want to do this repeatedly. It's important with acupressure that you repeat often. You don't have the needle acting as a conductor, so you have to kind of do it for a couple of minutes and then come back to it, and hopefully over time the pain will lessen each time. So like I said before, it's really important to understand the origin of your headaches, especially if you're experiencing chronic headaches more than once a week. So most days of the week, if you're getting a headache, this could be a sign of a serious medical condition, and you want to visit your MD or your local acupuncture physician to better understand why this is happening. In order to find a qualified practitioner, please visit acufinder.com. I'm Hillary Talbot, and that was Acupressure for Headaches.